Hello ladies and gentlemen, we're going to just talk about the nervous system and its organization into the autonomic nervous system, and it's the autonomic nervous system that I briefly want to touch upon. Now, as you can see, the human nervous system is essentially divided into a central nervous system and a peripheral nervous system. The important thing to remember is that the central nervous system not only include the brain, but it also includes the spinal cord, which is an extremely important thing to remember, because sometimes people can kind of omit this thing, and then obviously they can't keep this in their mind that it's not only the brain but also the spinal cord. So just keep this in mind, that spinal cord is also included. The other thing is that although the autonomic nervous system is classified as part of the peripheral nervous system, which is essentially everything excluding the brain and the spinal cord, but the autonomic nervous system also has got a significant overlap with the sensory system, with the sensory input going through the efferents back towards the central nervous system. Now, the sensory system consists of sensory input from the internal stimuli, which are essentially the proprioception and plus others, and the sensory input from the external stimuli and our five senses, which is essentially vision, touch, hearing, etc. Now, the autonomic nervous system is the one that I wanted to touch upon today, because I found it very confusing when I was trying to figure out what is sympathetic, parasympathetic, and how they are organized and formed. So just to start with this, just remember that it's essentially divided into a sympathetic component, there is a parasympathetic component, and there's a third component which is called the enteric nervous system, which is also called the primitive brain of the gut, and apparently it is allegedly claimed to be having more neurons than our brain itself. Each of the sympathetic and the parasympathetic components of the autonomic nervous system have got preganglionic fibers and they have postganglionic fibers. As you can see, preganglionic fibers and the postganglionic fibers. And this is very important to remember, because this is how you will learn the autonomic pharmacology once you go to your next classes. So essentially this is how it's gonna work, and anyway, let's go on to the okay, now the as I just spoke with you and told you that autonomic nervous system is divided into sympathetic component and a parasympathetic component, and the important thing was that they had a preganglionic component and a postganglionic fibers. Now these neurons secrete what we know as the neurotransmitters, and the important thing is that all preganglionic fibers always secrete acetylcholine. Okay, this is very easy to remember. And the parasympathetic postganglionic fibers also release acetylcholine. This leaves us with the postganglionic fibers of the sympathetic nervous system, which generally speaking release norepinephrine. Okay, so the postganglionic fibers of the sympathetic nervous system release norepinephrine, except, very important exception, sweat glands and some blood vessels in the muscle. Okay, now okay, we'll just skip to the next step and the next, yeah, all right. Now the very interesting thing is how the sympathetic and the parasympathetic fibers are arranged. You have to just remember there is a regarding the parasympathetic system, there is a cranial parasympathetic outflow, and there is a a sacral parasympathetic outflow. Okay, this is all you need to know at this moment in time. And the parasympathetic system is the more tricky one. Okay, and the reason it is tricky is that you see these long chains, or the trunks that we call the sympathetic trunks, or the sympathetic chains, which are arranged on the either side of the vertebral column. This is the spinal cord. Vertebral bodies have been removed, obviously, for convenience of understanding. And sympathetic trunks extend all the way from the cervical end down to the sacral end, where they join together to form what we call as the ganglion impar. Anyway, we'll come to that now. Now, this is the interesting thing, because this is where it's most tricky. In fact, what I'll do is I'll go to the better slide for you to understand. And yep, yeah, that's it. Okay, now this is the slide, which is really the great slide. Now, as you remember, I said parasympathetic outflow cranial part, parasympathetic outflow sacral part. Now, this is the spinal cord, and these are the sympathetic trunks on the either side. Okay, these extend from the cervical area here all the way down to the sacral area down here, where they join together from this side and this side, and form what is known as the ganglion impar down here. Okay, now the tricky thing is that the nerve roots arising to give rise to these sympathetic trunks arise only from T1 down to maybe L2, L3 or L4 levels, not more than that. L2, L3, L2 and L3. Okay, this is very important to remember. Then the question arises how they extend all the way down to the sacral area, and the answer is this diagram. Now you have to remember that from the intermedial lateral horn of the spine, gray matter of the spinal cord, once the just let me pick up another color so that I can draw it better for you. Now, this is the intermediolateral or the lateral horn of the gray matter of the spinal cord. They have got the cell bodies of these preganglionic sympathetic fibers. Once this fiber exits, it comes off from the ventral root, goes down here all the way, goes into the sympathetic ganglia. This is the sympathetic ganglia, this swollen body, and instead of synapsing here, it goes all the way up. Say, for example, in this case, superior cervical ganglion. Okay, now this is what the superior cervical ganglion is, and this is how they extend all the way. They come out here, and instead of synapsing in that ganglia, they come all the way here and synapse somewhere here. Okay, and that's why they extend to the superior aspect. Another fate, which is the synapse at the level of the entry. So again, lateral horn, come out here from the ventral roots, go all the way here, enter the ganglion at the same level, and actually synapse here with the post-ganglionic fiber. And this is now the post-ganglionic fiber going all the way to the effector organs. Okay, the third fate is that it comes out here and travels all the way down, and travels down all the way and synapses in a ganglion at a much lower level, and then goes to the effector organ. And the last but not the least fate is that the cell body, preganglionic fiber, comes out through the anterior root, goes all the way here without synapsing in the ganglion. It goes out to the abdominopelvic splanchnic nerve. Very easy. Okay, so these are the four fates that each of these nerve roots would encounter, and that's how they give rise to the all these sympathetic trunks on either side of the vertebral column, arranged very nicely all the way from the cervical region on top here all the way down to the sacral region. Okay, let's see. Yeah, okay, so this is again the same thing that I was trying to explain to you. So, and this is a nice one just to show you how the sympathetic trunks are formed. As you can see down here, these small swellings, these are the ganglia. Small ganglia are essentially collection of the nerve cell bodies. Okay, all these, and these are white and gray, white and gray rami communicantes. Okay, and they come down all the way here on descending down, and as I said earlier on, this is the ganglion impar. Okay, just a quick revising thing. The sympathetic trunk arises from the nerve roots arising from T1 down to L2, L3 level. That's it. But the sympathetic trunks, as you can see, they extend all the way from the topmost region of the cervical vertebral column all the way down to the presacral area, where they form the ganglion impar, which is essentially the fusion of the right and the left sympathetic trunks. Okay, so I hope this was of some sort of help to you. Now this is just a nice mnemonic that I encountered somewhere. Someone told me about this one, about the sympathetic receptors. Alpha receptors, this looks like a string, which is, and if this is one end, this is the other end. If you stimulate, it pulls the strings and causes vasoconstriction. So alpha receptors can cause vasoconstriction. Beta 1 receptors, there is only one heart, therefore the beta 1 receptors are in heart predominantly. Okay, and beta 2 receptors are the predominant receptors in lungs because there are two lungs. Hope this is a quick mnemonic that helps you remember these receptors and their distributions. Okay, and thank you very much for listening. Have a good day.